So the treatment for plantar fasciitis is largely conservative. So very, very rarely does it require surgical intervention. I think the other important thing to notice or at least be aware of is that some things can mimic plantar fasciitis. So something like a calcaneal stress fracture, which is a heel bone stress fracture, or tarsal tunnel syndrome, which is like carpal tunnel syndrome but of the foot. So they can kind of mimic that arch pain that you see with plantar fasciitis, but assuming that stuff's not what's going on, plantar fasciitis generally gets better with conservative management. Much to what a lot of people realize is that plantar fasciitis can take really several weeks to months to even completely improve, and that's with doing the right stuff. So I start very simple calf stretching, particularly what's called eccentric calf stretching, which is a slow and controlled stretch of the calf muscle, holding that deep stretch, and something else called plantar fascia specific massage. And I think that's a better version of rolling the arch on a frozen water bottle, which I think a lot of people come in and they've read that online or somebody's told them to do that. So I think it's a better way of working on the plantar fasciitis from there. There is, appropriate shoe wear changes, good supportive arches. There's steroid injection into that area, but generally try to reserve those for when we really need it, because as you can imagine, it's not a particularly pleasant injection, but it can be very helpful when other stuff has failed. Anti-inflammatories, activity modification, things like that. And then again, there's other non-operative modalities that you can consider. PRP injections, which are platelet-rich plasma, and basically trying to induce healing in that area. And then similarly, shockwave therapy and formal physical therapy to maybe consider some dry needling or other anti-inflammatory modalities are all non-operative ways of kind of dealing with this.